everyone. A very good morning to all of you. Greetings for the day. I'm Sayukta from Beautiful Spotless Skin team, and today we are doing this Insta Live on a very important topic, which is melasma management. Now, I'm sure you must have seen people with brown color patches on their face, especially women. In our society in India, around 40 to 65 years, women, 95% of them present melasma. Now, what is melasma? How to prevent melasma? In case melasma is there, what to do, what not to do is going to be our focus for this Insta Live. And today, we have with us as an expert Dr. Roshini Rai from Bangalore, who is a dedicated dermatologist with a robust background in clinical dermatology, cosmetology, and dermatosurgery. So she completed her MBBS from S. Najaligappa Medical College and Research Center in 2015 and went on to earn her MD in Dermatology, Venereology and Leprosy from SDM College in Medical Sciences, Dharwad in 2019. To further enhance her skills, she pursued a fellowship in dermatosurgery from St. John's Medical College, Bangalore in 2020-2021. Dr. Rai offers a comprehensive range of clinical and procedural care, excelling in various dermatological treatments and surgeries, passionate about providing personalized care, and she is committed to helping her patients achieve optimal skin health and confidence. So today, Dr. Roshini Rai is going to join us shortly. She is going to be our skin expert, and the topic is melasma management. Now, melasma is a common chronic skin condition. According to study conducted across 4 major Indian cities, reveals that more than 80% of the population present skin color heterogeneity on the face, irrespective of their age and gender. This heterogeneity mainly results from hyperpigmentation, spot, or melasma. So there are so many questions, that's already coming in my mind, like why it happens, who are more prone to having melasma. Because we have seen again when a lady is pregnant, during pregnancy also, she many a times have this issue of melasma. So is it just melasma or hyperpigmentation? Hyperpigmentation and melasma are the same word, or are they different? And why it is so common in our society, that women, especially women, even men get it, but especially women get these melasma so commonly. Especially when we go, at higher altitude, we see again people with a lot of pigmentary issues. So there are so many questions arising right now, and all of it will get answered by Dr. Roshini Rai, who is our expert for today. And viewers, if you have any question related, and we will try to get answer of that question. So today the topic of our conversation is going to be melasma and melasma management. Now, melasma and hyperpigmentation generally ignore the sign of aging. Many times when we ask people that why you are not going and consulting a doctor or taking advice from qualified dermatologist, they often say that we are aging, or we are diabetic, or we have thyroid or other issues. So we are bound to have these pigmentary issues. It's common, and we'll have to live with it. So is it the fact, or it's a myth? Do we really have to live with it? Or is it just a sign of aging? Or we can get rid of those, really big patches, brown color patches. Plus, I'm sure melasma doesn't happen overnight. It will, grow gradually. Initially, we'll see small spots, which can eventually gradually grow in size. So, what we can do if we go and consult with a right person, which is a qualified dermatologist at the first place, is it going to help us in a better way? Or we can get it treated at any point of time? Or is it just the face where we get melasma, or we can get it anywhere in the body? So there are so many questions related to melasma, and we'll try to get answer of all of them. And again, in case you have any questions, please feel free to ask us. So Here we go. I think,
Hi,
yeah,
hi.
Dr. Roshini Rai, a very warm welcome to you.
Hello, Samyukta. Thank you.
Hello, doctor. How are you doing today?
Good, good. How are you?
I'm absolutely fine. Thank you so very much, doctor. And thank you for joining us because today we are going to talk about a very important topic that is melasma. And
Right.
melasma is quite a common issue in our society, specifically. To
Yes.
start with, doctor, what is melasma?
So melasma is a chronic pigmentary condition which is characterized by like a focal hyperpigmentation, especially involving like the central face. So it is more common in usually females and in the 30s to 40s age group. So it is a pigmentary condition which is very persistent and generally resolves and keeps coming back, and it is quite a menace. Yes.
And doctor, because we are talking about melasma, what are the various causes of melasma?
So melasma majorly is caused by three reasons. One is genetics, two is pigmentary, this hormonal reasons, and three is sun exposure. So coming to hormones, basically, so generally it is more common in a pregnant lady or patients with ovarian tumors or someone who is on oral contraceptive pills or hormonal replacement therapy post menopause. So these hormones generally make the skin more prone to pigmentation. So apart from this, there is a genetic basis. So generally, in a patient with melasma, their skin itself has a tendency to pigment. So there is more melanogenesis, more melanocyte transfer, and the antioxidant ability of the skin is kind of lost. So genetically, they have more, they're more prone to oxidative damage caused by either sunlight or some heat. So basically, the skin itself has some amount of antioxidants. Right? There is glutathione, there's melatonin, which is naturally present in the body. And in case of any kind of stress or sun exposure, the body usually counters it. But in melasma, there is innate deficiency of these antioxidant mechanisms because of which the person is generally more prone to melasma. And apart from this, there is also sun exposure. So sun exposure, typically the four wavelengths that are associated with melasma are ultraviolet
Hmm.
T, ultraviolet A, visible light, and the infrared spectrum. So generally, we always recommend broad spectrum sunscreen. So what it means is, so it should cover all these wavelengths. So UVB radiation directly affects the epidermis and causes melanin to increase. And UVA, it is penetrating deeper. It is actually affecting the dermis and causing photoaging, like all the lines and wrinkles that appear because of sunlight. Then the infrared radiation is basically the heat. So even if a person is exposed to high heat, like a person, suppose, working in mines or some cook who is exposed to a lot of sunlight from the gas stove, they are also more prone to melasma actually. And also the visible light. So it's the ambient sunlight that is coming through your windows, the windshield of your car. That is also actually enough, especially in the darker skin tones, to trigger melasma.
Okay. Now, as you said, doctor, that applying sunscreen is a very important part and should be one of the most important part of our skincare regimen, skincare routine. But the fact remains that in our society in India, still 67 to 70% people are not using sunscreen on a regular basis. We use
Right.
sunscreen only when we go out, step under the sun, etc., etc.
Yes.
So, are there any myths that you would like to burst regarding sunscreens, that why people should use sunscreen on a regular routine basis?
Yeah, so generally people have this myth that sunscreen has to be applied only when you step out. So that is not the case. So in fact, when you're indoors, there is sunlight coming through the window. That is the visible light and the infrared spectrum. That is sufficient because your skin is already sensitive to melanization. So that means even a very small amount of sunlight is enough to trigger it. So then again, there is also the question of the quantity of sunscreen to be applied. So generally, there's a teaspoon rule. So half a teaspoon has to be applied for the face and neck. So that is the quantity that we are looking at. So anything less than that is not sufficient. So generally, and also the question of SPF. So SPF is basically the amount of sun protection factor. So that is the UVB protection that the sunscreen offers. So generally an SPF of 30 is sufficient if the sunscreen is applied properly. since most people don't apply it in adequate amounts and do not reapply as frequently as they should, we generally recommend a SPF of at least 50 so that the reapplication can be minimized to some extent.
Okay. Now,
Yeah,
there are so many informations written on the box or the tube of sunscreen. One, you
correct.
said that it would be a broad spectrum, then the SPF. But then there
Yes,
are other informations also regarding the boot star rating, to
correct,
PF factor, etc.,
correct,
etc. So, what are the
correct.
basics to look for? Because there are so many information. So, what are the basics to look for, doctor?
So yeah, a boot star rating of at least 3 to 4 is what we're looking at, and a PA of at least 3+. So 3+, PA rating is basically your UVA protection. So PA rating should be of 3+, would be giving you about 90% protection from UVA. Whereas a PA4+ will be giving you up to 95% protection against UVA. So these are important things to look for. So minimum SPF of 30 and a boot star rating 3+ and a PA rating of 3+ is what we are looking at. And also there is tinted sunscreen. So when it comes to melasma, we would recommend a tinted sunscreen which has iron oxide as well. So that gives additional visible light protection, which is also important when it comes to melasma.
Now,
And of
tinted
course, a little
sunscreens are those, I
camouflage.
guess, which has a very foundation kind of a look, right?
Correct, correct. That also gives the patient some amount of confidence when they're going through the recovery process. That it gives you some kind of coverage and gives you some kind of confidence also. Additionally, that is just a plus. Yes.
You also said, doctor, that reapplication is equally important, but then, people often wonder,
Hmm.
mostly those who are working or, living under very controlled circumstances. For example, I'm working 8 hours in a air-conditioned, centrally air-conditioned office, or
Yes.
my communication time is not much, so I'm not under the sun for much. Or even if I am in a car again, which is, air-conditioned, or
Hmm.
I'm working from home.
Hmm.
So again, do we need to reapply sunscreen twice or thrice in case we are into such controlled circumstances, especially in case of melasma or as a preventive measure for melasma?
Yes, yes, you do actually. So sunscreen is efficacy only lasts for like about 2 to 3 hours. So after that, even if the sunscreen is on your face, even if you have not sweated it out, it's basically not working. So even the ambient light, like I said, if you're sitting near a window, suppose, and even the indoor lighting to some extent has some impact on the melanogenesis. And also the screen, the blue light coming through your screens is also a factor. So nowadays there are blue light protection also that are included in sunscreens. So those are useful, and reapplication is still recommended. So generally, if you're indoors, I would recommend a reapplication in the morning and reapply in the afternoon. That is sufficient. So if you're going to be outdoors, I would recommend every 2 to 3 hourly application. And if you're swimming or if you have some excessive sweating conditions, every hourly would be ideal. Or use a physical sunscreen, which will stay on a little longer. So yeah.
Right. Now, doctor, there are two terms that we normally get to hear. One is hyperpigmentation, one is melasma. Hyperpigmentation is quite a common word with layman's also. Melasma is not very common that way.
Yes.
So, are they the same or are they different? Melasma and hyperpigmentation.
So hyperpigmentation is basically an umbrella term. It's like a broad terminology. So anything that causes discoloration in the skin, like a darker discoloration, would be termed as hyperpigmentation. So that can be of various reasons. Sun tanning is hyperpigmentation. Any post-inflammatory hyperpigmentation following some acne, that is also hyperpigmentation. Melasma is just another kind of hyperpigmentation. And melasma is specifically, it is the distribution that determines what kind of hyperpigmentation it is. So that centrofacial distribution, especially in the cheeks and the nose, that is
Mhm.
classically melasma. Yes.
Okay, so melasma affects just the face, and is it just a cosmetic thing that will affect our appearance, or deep down also it affects our health, doctor?
So it is majorly a cosmetic concern. But yeah, cosmetic concern, even though being a cosmetic concern, it can cause a lot of mental issues. So patients' self-esteem gets affected. They are, prone to anxiety. Some kind of, depressive symptoms are seen in these patients. So even though it is a cosmetic concern and it affects the face, it can also affect the body for that matter. So, but it is more common on the face, which is a very visible part of the body and very difficult to cover up. So it really, tampers with the person's self-confidence. Yes.
Absolutely. Many times people go into depression because they have this chronic skin condition called melasma.
Yeah.
I've seen really bad cases of melasma. I mean, as a layman, as a doctor, you have seen a number of cases probably. But my question, doctor, is I'm sure it doesn't appear overnight. It won't completely cover your face overnight. It will grow gradually, right? So how does it start? When we need to be, careful. Okay, I'm getting melasma. I need to go and consult the doctor. So please
Yeah.
guide us on that.
So generally, as an age group, the people in their 30s and 40s, it generally starts. So it generally starts, it can start anywhere on the face. So there are three different patterns of melasma. So it can be either centrofacial, which is involving the cheeks, the nose tips, the chin. So usually the center of the face. It can be malar, which is just the cheeks, or it could be mandibular, which is involving the jaw. So any signs of pigmentation you see in any of these parts of the face, you should be more vigilant and probably seek treatment as early as possible. Because of course, the earlier you seek treatment, better the prognosis will be and the faster the relief will be.
Okay. Now, those who have a family history, and those families where one of the family, mother, grandmother, etc., they already had melasma. So, is it a genetic thing? Does it increase the risk of the
Yes.
other family members?
Yeah, it has been seen that up to 60% of the patients do have at least a first degree relative who has melasma. And of course, an identical twins and all. There is a genetic basis. So there is a very strong genetic basis with melasma. So yes, if you have a family history of melasma, definitely you are much more likely to develop melasma in the future.
And in that case, what should one do, as a preventive measure? I mean, does
Hmm.
he or she need to start early, see a doctor early, etc.?
So yes, there is nothing much to do as a predictor that you will develop melasma. There is no definite way of knowing it. But generally, it is during the pregnancy time and where there is hormonal disturbance. That is when the signs of melasma generally come up. So as a preventive, of course, using regular sunscreen is definitely the most important thing one can do. Apart from that, yes, you can start early antioxidants. So there are antioxidants like glutathione, melatonin supplements, and there are sun protectants, oral sun protection like polypodium leucotomos, some turmeric, etc. These antioxidants can generally have some impact in preventing melasma, although not 100%. There have been no studies to show like what the impact will be, but definitely it can, probably delay the symptoms of melasma and definitely help manage it better in the future. Yes.
Right. Now we will like to talk about a very common practice that we do in our society, which is home remedies, going by what our friends or family members are asking us to do,
Yes.
going for over-the-counter topical applications, medications, etc. And these days we have so many influencers on various social media platforms, and not most of them are dermatologists. They are not qualified to talk and preach about skin, but then they do, and we fall for it. Again, market is
Yes.
flooded with products claiming that they can, control your pigmentation or melasma issues, and people fall for it. So, to start with, doctor, home remedies, do they really work? Because people tend to apply a lot of potato juice or papaya paste on their face, hoping that it will, fade away eventually.
Yes. So melasma is such a multifactorial disease, and it has so many, at different levels, so many factors that are contributing. So a little papaya paste would barely, touch the surface of it. So generally, yes, there are too many people advising you on what to do, starting from your home, so your mothers, your beauty parlors. So they are also giving creams, some unknown creams that people are applying
Wow.
left and right, and it is
Yeah.
causing a lot of problem. So
Yeah.
also over-the-counter creams that people buy from medical stores. So generally, these are steroids. So
Okay.
anything that can clear melasma overnight is a topical steroid generally. And topical steroid on prolonged use has multiple side effects. So starting from making your skin extremely sensitive. So there is something known as steroid dependence that happens. So as you use steroids, your skin cannot live without steroid anymore. So there is increased acne formation, thinning of the skin, development of white patches, increased facial hair. And on stopping the steroid, it is going to darken your face and make it extremely sensitive to sunlight. So steroids are generally a very big menace, and treating that is going to add a few more years to your treatment of melasma. So apart from that, there are also these fairness creams which contain mercury. They have been found to contain mercury, which can really damage your lungs, your kidneys. So it is really not safe to just apply over-the-counter creams like that. Please seek medical advice, and please apply the right things, because of course melasma may be a tedious condition to deal with, but there is a definite solution. So you must seek dermatologist help.
Right. And again, if you are a pregnant lady, because melasma is quite common during pregnancy, please, please, please stay away from over-the-counter medication, any kind of topical application, because it could be really harmful for you and your baby. And in case you are pregnant or lactating, please consult your doctor, a qualified dermat. Of course, you are in touch with your gynac, but please also consult a qualified dermatologist to find a safe solution. So it's a big no-no in case you are pregnant
Yes.
for the non-lactating women.
Yes.
Now, doctor, talking about the diagnosis and treatment part, when a patient comes to you with melasma, are there any tests that you normally recommend, or just by clinical investigation, you're sure that this is melasma, this is probably the grade, etc.?
So largely melasma is a diagnosis of clinical, diagnosis. So it is the typical presentation. So apart from that, there are ways to confirm melasma. So there are dermoscopy. It's basically a device which helps to determine the pattern in your skin. So when you look closely, you can see certain reticular, arcuate, reticuloglobular, those patterns, which are very diagnostic of melasma. It can also help you assess the level of melasma, if it is purely epidermal or if it is deeper. So that helps you kind of gauge the, extent, and also prepare a treatment plan accordingly. Apart from that, yes, if you really are suspicious about what it is, you can always go for a skin biopsy, but it's generally not recommended.
Mhm. Right. And what are the treatment options available, doctor?
So treatment options are plenty. So categorically, there are topical treatments, which are the creams that you apply. There are systemic treatment, that is the oral medication that you take, and then there are procedures. So initially, the main line of treatment would be prevention. So main thing it would be sunscreen application. So let's begin with sunscreen as a topical agent. So sunscreen, yes, like I said, broad spectrum, and to be applied to the required amounts and more frequently than you would normally do. Then there is the topical depigmenting agents. So most commonly, the most common agent that we use are hydroquinones. So hydroquinone is a strong depigmenting agent. It's a tyrosinase inhibitor. Gives great results, but then again, it cannot be used long term. So that's why the follow up is very important. So patient has to come back to you, and the topical medication needs to be changed. So we need to give different agents that work differently, so that we can give you that effective outcome. Okay. Apart from hydroquinone, there's niacinamide, there's topical retinoids. There is topical retinoids. Basically, they exfoliate your skin, making that pigmentation less visible. Then there is glycolic acid, there's kojic acid, there is topical tranexamic acid. So topical glutathione. There are multiple ingredients. Topical vitamin C, which is basically an antioxidant, which can also effectively help clear melasma. Then coming to systemic treatment, there is oral tranexamic acid, which we are using very, very commonly these days, which is highly effective. So generally at a dose of 250 mg twice a day, given for like 6 months to 1 year. So it basically targets the vascular component of melasma. So there's a lot of inflammatory vascular overgrowth in those regions of the melasma affected skin. So tranexamic acid brings that down, and it is slowly tapered over time, giving you great results. Then there is oral sunscreens. You can use carotenoids, beta carotene, astaxanthin, lycopene, all these ingredients, which are majorly sunscreen as well as antioxidants. And there's oral glutathione as well that you can use. Then coming to procedures. So the first line of procedure, if the patient is not responding to topical or systemic medication, would be peels, chemical peels. So chemical peels like glycolic acid peels, Jessner's peels, salicylic peels. So they are effective, especially if the melasma is epidermal. So it works very well. So in case there is deeper melasma, you can go in for laser as well. So there is Q-switched LDR laser toning, which is low fluence laser that basically breaks down the melanosomes. So in melasma, the melanosomes are like big, and they are dendritic, like large dendrites are there. So low fluence laser basically breaks down these melanosomes, clearing the pigmentation which is deep seated. So apart from this, there is the PRP, microneedling, and also you can give tranexamic acid injections into the melasma lesion. And there are vascular lasers also that will help in melasma.
Right. Typically, how much time does it take, doctor, to start seeing results on your melasma? And of course, it will depend upon the how much bad it is. But still, typically, how much long does it take?
Yes, it depends on the severity. If you're at mild to moderate melasma, so in 1 or 2 months, you should be able to appreciate some kind of a difference. So, yeah.
Okay.
But yeah,
Many times,
complete clearance will take much longer. So it
much
may
longer.
take
Because
anywhere
many
between,
times,
huh,
yeah,
it, it
many
may take
times I've
anywhere
seen patients
between six to
asking.
8 months. Okay,
Ah,
sorry.
okay. So patients often ask that will it ever, completely go away, or how much time will it take, or how long I will have to be on medication, etc. So
Yes.
does it ever? I mean, does it completely disappears? That scenario comes.
Uh, to be very honest, no, there is no complete like permanent solution for melasma. So there are a few lucky people for whom there is spontaneous resolution that happens. So that is a very small number. For most patients, it's a chronic problem. So there is always persistent inflammatory, infiltration that is happening in the skin. So the skin is always prone. So little sun exposure, it can get re-triggered at any point in time. So even after complete clearance, maintenance becomes extremely important. So there is
Right.
no
So
day
maintenance
where you
is
can skip your topicals really. Yes.
right. It also happens. For example, you have given me a prescription to be followed for 3 months. I
Right.
followed it for 1.5 months, and started seeing results. So I'll stop it because I'm getting results. And again, in case I see flare-ups, then because I have the prescription, I can anytime go and get the medicines and start my treatment all over again. Many times patients don't keep their doctor in loop, they don't inform their doctors, and they do such kind of things.
Yes.
What's your advice on that?
So generally stick to the prescription, and also follow-ups are very essential. So even if you're continuing to apply the same thing, there is something known as resistance that happens. So there are the receptors becomes extremely sensitive. It is not going to respond beyond a certain point. Then you will not be happy with the result. So always get back to the doctor so that the formulation will get revised, so that a different modality can be tried each time, so that we can combat this melasma effectively. So follow up is very important, and at least stick to sunscreen and moisturizer, because that is the basis of the treatment. So at least it'll prevent some increase in melasma, if not cure it.
Mm. I'm getting so many questions by our viewers. Some of them we have already covered. I'll take the rest of them. So Palkesh
Yeah.
is here, and his question is, what lifestyle changes can help in managing melasma?
So lifestyle specifically, it is the sun avoidance, that is the kind of lifestyle modification that we would recommend. Of course, like sun avoidance is not a, uh, thing that can be done like effectively, but even with sunscreens, one needs to know that it is only 55% protection against sunlight. So the rest has to be done by physical protection. So using a mask or some, protective clothing to cover your face, like a scarf or something, would be 100% effective. So apart from that, yes, a very good diet rich in antioxidants. So I can't stress enough how important antioxidants are. So diet rich in nuts, fruits, berries would be great addition to your life. And of course, regular exercise, maintaining your body weight and all these will definitely help in the long run.
Fair enough. We have Harshit Verma, and his question is, can men also get melasma?
Yes, not very commonly, but yes, there have been many instances where men have developed melasma. Specifically common in a person who is doing some amount of field work or some laborer, generally seen in those people. Like even there has been seen some kind of a hormonal correlation with men with melasma. They have been found to have lower testosterone levels. Like a person who is on hair loss treatment on finasteride, they are also more prone to apparently develop melasma. So yes, it is seen, and the management is pretty much along the same lines. So sunscreen is important for both men and women equally.
Okay. Arun Mishra is here. His question is, can drinking more water cure melasma? And it's quite a tradition in our society. We feel water is the solution for every problem. So is it true, doctor?
Yes. Strangely enough, so people say drinking water will cure all your skin problems, and a lot of celebrities claim the same thing. But internally, drinking water and skin hydration are pretty much not the same thing. So, drinking water does help a lot of your organs, clears toxins from your system. But skin hydration needs moisturization. Okay, so moisturization again has been associated with improvement in melasma because in melasma there has been noticed that there is some thinning of the stratum corneum or the skin. So yeah, application of topical moisturizer might help, but drinking water is definitely not going to solve anything.
Yeah. Drink adequate water. That is important for your overall health. But for
Absolutely,
skin,
yes.
you need to stick to what doctor has said. Yeah. Aniket is here. His question is, how does air pollution affect melasma?
Yes, there has been found some relation to air pollution in melasma. It is a certain receptor that gets triggered in melasma, and air pollutant can actually trigger melanogenesis. There has been noted this finding. So, metropolitan cities where there is rise in air pollution, there has also been a rise in melasma.
Mhm. Whenever we go to higher altitude, doctor, we see a lot of patients with, or a lot of people with melasma, those who live in hilly areas, mountains, etc. We also, when
Yeah.
we go out for, say, vacations, etc., if we are going to a beach vacation, we make it a point to carry sunscreens with us. But if we are going, on the hill, we feel that it's going to be snowy and, cool, pleasant. We don't need a sunscreen probably, but then the people there are so badly affected with the pigmentary issues or melasma. So,
Exactly.
how would you like to address it? Is it important to use sunscreen even when we are going for higher altitudes?
Yes, that's actually a good observation. So as the altitude increases, so the UV indices also increase. So the UV radiations are much higher as you go higher in altitude. So yes, wearing a physical sunscreen, pure physical sunscreen like a paste like the cricketers apply would be the best thing when you're going trekking on higher altitudes. But apart from that, yes, reapplication is very important.
Mm. A very common question people often ask, can melasma lead to cancer?
No, not really. There has been no finding. Yes, it is a common myth that it may lead to melanoma because they sound pretty similar, but no, not really.
And also because many times you also said that, just in case we are not sure, we will do a biopsy. And biopsy is something we normally associate with,
With cancer,
malignancy
yes.
or cancer. So is it the same in case of skin biopsy?
No, skin biopsy doesn't mean cancer. It is not that we are suspecting cancer. So skin biopsy basically gives you the exact picture of what's going on inside your skin. So there are certain patterns that makes you identify what exactly the disease process that is happening inside us. So it has nothing to do with cancer. Yes, skin biopsy is used to detect cancer, but it can be used for any dermatological condition to identify it. So nothing to be scared about skin biopsy.
Right. And doctor, before we sum up the whole session, any take-home message, any do's and don'ts that you would like to share with our viewers?
Yes. So one thing that all the people who are suffering from melasma need to know is that it is not the end of the world. There is a solution. Please seek medical help soon. Yes, it can be a very frustrating problem. So they do apply topical creams. They've tried everything, but it keeps coming back. It is that kind of a condition. But seeking timely medical help and doing the right treatments will definitely give great results. And there are people who are extremely happy and lead a completely normal life. No one can know they had melasma. So it can be maintained at that level. So you can only do that by consulting a dermatologist and taking timely help and timely treatment and not just fretting about it and applying over the counter creams. Please avoid using any over the counter creams because they can be more detrimental than beneficial in case of melasma. So
Right.
that would be my take home message.
Right, doctor. And as soon as you spot anything which is not normal on your skin, probably you won't be able to make out what it is or what it can lead to. Please go and consult a qualified dermatologist. Don't fall for anything else. Don't fall for over-the-counter medication, what your family, friends, relatives are saying, or influencers are saying, or your beauty parlor auntie is saying. Please go to the correct person at the correct time. Easily you can, manage your problem and control it. Thank you so much, Dr. Roshini Rai. It was wonderful talking to
Thank
you.
you.
Thank you for
Thank you so
making this
much.
session a very informative one.
Thank you so much. Thank you, Samita.
Thank you, Doctor and viewers. Thank you for your active participation. Stay happy, stay healthy, and have a great day ahead. Goodbye.